Okay, thank you. Well, I'm Robert Dempsey, and this is our update on the novel COVID-19 crisis. I think it's a very important time for us to stop, reflect, think, refresh, recharge, because we're all getting tired and we're a little bit frightened, and there's reason to be, but there's a lot of resources we're going to call on to take care of this problem. And I think if we think that way, we'll do fine. I want to point out, though, that there are some very important things going on, and the implications are worldwide. We're about 10 months into this crisis, and it's, of course, called novel COVID-19 because it was really discovered at the end of 2019. We've had a lot of setbacks in the last weeks, actually 2 weeks, which is being seen in certain spots of the world. There may be 70 million people affected in India. We don't know. These are just estimates. We see an increase in our own state. And when there's trouble like this, I tend to reflect. And I've been actually thinking about my parents lately. My mother had a saying about count your blessings. And she was right, because in a crisis that may yet bring out the best in all of us. And that's what I want everybody to focus on. In spite of the fact that we've had some bit of a setback, we're still doing well. We still have great resources. We'll talk about that. So worldwide, we have surpassed 1 million deaths. And that's the ones we know about. And that's a lot because most of the highly popularized endemics, pandemics, Ebola do not hit numbers like that. There are things like tuberculosis and malaria and smallpox over generations time. Most people look at the major 20th and 21st century epidemics, pandemics, different variations of flu mostly. They never really got to these kind of numbers. And so that's important. 200,000 of those in the US, which is way out of proportion to the rest of the world. Unfortunately, Wisconsin has become a hotspot. These are the things we fear because this disease is not spread evenly. And those areas that were spared, often rural areas, are now seeing this disease, and that's informative. For the last week, we've had over 2,000, I think 2,817 new cases in the state each day. That's going to add up. We have 646 hospitalized patients in the state. So actually, Dane County and Madison, in spite of our undergraduates, have been relatively spared from the hospitalizations. We're in the dozen range, depending on the day. It goes up, it goes down, up to 20. We can handle that. We get worried if it gets much above that. There are 205 people in ICUs for COVID in this state right now. Most of those are in the Wausau, Green Bay, Fox Valley, which I can assure you, anybody that's gone north during this past year realizes that there was a large population in that regional rural area that didn't believe this epidemic was ever going to come to them. So masks were generally unknown. Legislators from that area worked hard to defeat, with the help of the state Supreme Court, the idea of having statewide mandates. Although the governor has persisted with some, they're still resisted. Unfortunately, this is beginning to spread to those areas. Also, we're seeing it's affecting children. Now, it's not affecting children with as much symptoms as it is disease, as a reservoir, a spread of disease. And it's now estimated that 20% of the disease in the United States is in children. And that does not just mean the college students, where most of it is in this recent month. The state has had 1,281 dead. And when we think about, young people, it begins to hit home. Many of us may know someone, an elderly person in a nursing home, but my daughter, who teaches at UNC camp, one of the UNC campuses, has had her first student die of COVID. So it's very real. Per capita, unfortunately, Wisconsin is the third worst state in the nation. North and South Dakota, per capita, have the highest rates. So we have to take this seriously. The numbers, though, are intriguing. We've had about 115,000 people sick in this state. About 19,000 of them are still sick now. And only 1.6% of our state have antibodies. So that means there's a lot of us that are susceptible to this disease. Now, this has caused a great impact on society. The isolation, the total shutdown basically destroyed the economy. We need to find a strategy that allows people to work, to have a life, to not become psychologically crippled or violent, and yet safe. And we do, because vaccines may or may not come. We need to wear masks. We need to wash our hands, which is really the most effective strategy. We need to distance, both socially by distance and staggered by schedule. So jobs can be done, but on staggered schedules. The problem is, of course, that what has happened this year have been entire industries shut down. Hotel, entertainment, many of the foods and restaurants, travel. The airline industry could shut down in the next weeks, depending on subsidies which have kept them going. And that would impact us forever as far as returning. And the results of such things are to bring out longstanding fears and problems, anger, violence, and the worst of all, elections. In parts of the world where I work, elections are very, very dangerous. I hope and pray we do not get to that. But elections are the basis of our democracy, so vote. So what do we do when we have this resurgence? We're like we were really in May, but it's a little different. We have more cases. We have a consistent number of deaths. We don't have as many hospitalizations. I believe this is a more infectious and less virulent strain than we saw in March and April. So again, a quote. One of my favorite sources for quotes besides my mother is Abraham Lincoln. And he said, most folks are about as happy as they make up their minds to be. So count your blessings. We know how to control this. Those three principles, those three rules will allow us to be safe. If we don't do it, then all we have to do is look at UW's attempts to reopen, to close, reopen, unless we are able to convince us, because it's us, about these things. And I mean that. I mean, I see some backsliding on people regarding distancing, regarding face shields in the hospital. You imagine how hard it is for our non-medical people. They need reminders, they need help, they need to understand that they're in it together. While each of us want our personal liberties, earlier Supreme Courts felt you were not at liberty to harm others. I don't know what this Supreme Court will say. So things like maskings, things like washing hands need to be enforced. But during this time, not only did we learn how to control it and maybe come up with a vaccine, I hope so. It would be the most definitive answer, and very good scientists are working on it. But it takes years, at the best, many months. We'll see what comes of that. In the meantime, we learn to live with it. We're going to be learning, and it's going to be requiring testing to do it safely, and vaccines and common sense. Testing could be important. A lot of activities like sports might be possible if we test properly. I'm more interested in testing so that visitors can come into the hospital to sit with their family member during brain surgery. That's a better use of testing, in my opinion. But the lessons learned from the sports may be able to be applicable, very quick testing. One of the important things is the recent approval of saliva testing, which is going to be a lot less invasive than the nasal swabs. And that's a big plus. As we gain on that, we learn to take care of each other, because that's what we do in medicine. And that brings up this issue of social justice. How do we respond to a crisis? We must respond with strength, with compassion, and with wisdom. It's been amazing when I see what's been done by the bright people, the people that have suddenly linked us together through Zoom and WebEx, etc., in ways we couldn't do before. Now, I'm sick and tired of Zoom and WebEx compared to personal meetings, but what we've been able to do in global sense is amazing. I'm now connecting with the neurosurgeons and the people needing neurosurgery in Sudan. There's no way on God's heaven that I could have gotten into Sudan, these areas of Sudan, safely in person. But electronically, we're in. And they're great people. And they want to change their country for the better. And the way I know how to do that is through healthcare. And that's what we do, and we do well. So online symposiums, online in real-time interoperative teaching is now possible and being started this month, something I couldn't have done a year ago. Everything in our lives, except the OR, slows down. We have time to think about things. We have time to appreciate what's important. We can go outside, thankfully, in this state, and we can embrace new challenges. And that's what I want you to do. Not only do you realize that we are doing better, believe it or not, with this pandemic, maybe because it's less virulent, definitely because we're better at treating it. Where before we would have 3% die, in Wisconsin, we only have 3% sick and a slightly lower number hospitalized and a lower number yet dying. So we are improving this. If we keep improving it, we will control it. And we have to do this worldwide. So how do we keep us stable, complete, enthusiastic, even in a crisis? Because that's what we do. Most of our lives have been crises of one type or another. It's how we choose it. Lincoln's make up your mind to be, how happy you are. So what I'm asking you is learn something new. Write that manuscript. Learn that new language. Learn to play the piano. Look out for each other. Probably the most important lesson. So schools have opened, and we've learned the good and the bad of that. We've learned the failures, and we've learned the risks. And I'm not willing to say, well, it's okay to just let everybody get infected because hardly anybody gets sick. That's nonsense. This disease, a lot of people seem fine. A lot of other people will have residual deficits of brain, heart, lungs, and kidneys. I don't want any child getting this. I don't want any adult family member getting this. But if we do, we'll take good care of you. But when the schools opened, we learned that we hadn't taught responsibility properly. And this massive increase was all people eating, dining, or partying together, primarily partying. It was very, very clear that the last surge was almost completely 18 to 20-year-olds. And they were always on the campuses. And that's responsibility because we can test, et cetera, and responsibility must have consequences when they don't. And some schools have been smart enough to withdraw, to expel the students if they did do unsafe practices and not refund the tuition to the parents, which does send a message. So we learn from everything. But believe me, we have other schools that have excellent examples of success, and they go on with staggered schedules, with limited but some in-person contact, and with a lot of online teaching until the whole society gets control of this. If we don't, it will devastate the people at most risk. The very poor countries, the very elderly, the very sick. It may cause lasting deficits in us. So this has got to be a pep talk. Living with COVID does not mean stop living. Do live, do go on, but do it by the rules. And it's going to work. Mask, wash hands, space, both in distance, but also in time, staggered schedules. This recent upsurge has cautiously been met with a cautious reopening, but the med school is pretty much going to be the same. Some students are allowed. I think people are presently in this department trying to be cautious about that till we see how the next few weeks go. I hope we can restore a sense of normalcy, but we're never going to be quite the way we were before. We're always going to be changed by this pandemic, but I'm confident in you that we'll be better for it. And so that's where we are. It's a difficult time. It's a bit of a pep talk, but it's time to count our blessings. And our blessings are that we're in healthcare. We're good at this. We have the resources. We have the PPE. We have the compatriots that understand this, and we'll do it together. Once again, I'm proud of you, and I thank you very much.